Dr. Parth Trivedi sir is having around 6 years of the experience, clinical as well as academics. Dr. Parth Trivedi is currently working as a lecturer in the C.M. Patel College of Physical Therapy in Gujarat. He has been postgraduated in the sports sciences from the Saurashtra University, and he has attended numerous conferences at the national and the international platforms, and also had been attended various workshops on the recent advances and recent advanced techniques of the physical therapy, including the disaster management, manual therapy, MFR, and various others. Dr. Parth Trivedi sir is also being awarded with the Young Achievers Award at the International Conference of Physical Therapy, which has been organized by Neuroscience Department of the AIIMS Delhi in 2017. He has also been awarded by the Young Researcher Award by the Venus International Foundation, Chennai. And he is also one of the few physical therapist researcher who is also a peer reviewer of the INAGO publication, and also the peer reviewer of the Journal of the Harmonized Research publication, and also an editor in the International Journal of Physical Therapy and Research. So he is also an editorial board member of the Ford Orthopedics and Sports Medicine. So we are really grateful and honored to have Dr. Parth Trivedi sir with us on the board. Thanking you, sir, for sparing your precious time to share your incredible knowledge, because you have lots of professional as well as personal assignments to do. Still, you find the time to share your expertise on the top. And today we are going to learn many more things from you. Thanking you again, sir. Thanks to all the respected dignitaries and senior academicians who has joined us and being so patient for this much of time. Really grateful to you. Thank you again, Parth sir. Over to you, sir.
Thank you, Dr. Himanshu, for such a wonderful introduction. I hope my screen is visible.
Yes, sir. Your screen is visible. Yes, sir. Your screen is visible.
Great. So you can see a bulb, I hope.
Yeah, yes, sir.
Yes. Okay, great. First of all, I'm very much grateful to Physio Inculcators for calling me as a resource person for this wonderful webinar, and especially for this day. It is very much proud and honor to me, especially with this webinar, because this date is very much important for our country. We are celebrating 74th Independence Day. And being an independent nation, we all know that we have all the freedoms and all the democratic rights in our country, which hardly any other country gives. And we are the world's largest democratic country. And yes, that is why we have all the issues and all our positives and negatives coming out daily, day to day. And personally, I am into research since my undergraduate days. I'm very much thankful to my seniors and my professors who had cultivated that seed into me since my undergraduate days, so that I can understand a bit of research. I don't say that I know everything, but I can understand research, and probably I can come out with things which the society wants. So the first thing which we always think about research is in terms that how to find out our issues and how to solve those issues. Yes, हमको हर बार एक ही क्वेश्चन रहता है कि and especially with whenever we consider our own research topics for the first time. When I did my first research topic, I was like nowhere. I had no clue that from where to start. मुझे कुछ भी नहीं पता था, and probably it would be the same thing with every other individual, because it is our system which has always taught us to believe others. Yes, हमको ऐसा ही सिखाया गया है, and we have much more focus on social studies and rhythms in our schooling days. So we are technically, or we are not inclined towards finding out problems. और अगर हम problem पूछते हैं किसी को, so people tell us that we are asking much more questions, so he or she should be bypassed. So that is the reason probably we are not aware about how to find out a problem. Yes. So when we think about research, it always says researching things. Okay, so probably you have two options always. Either you search things which people have not searched. क्या आप वो चीज ढूंढे जिसने किसी ने ढूंढा नहीं था? Yes. So somebody had, some great scientist had thought that why apple fell down from tree, वो नीचे क्यों गिरा, ऊपर क्यों नहीं गिरा, and उसकी वजह से फिर gravitational law आया. And then we had modifications in gravitational laws also, and it was researched into that issues. ठीक है, तो यही चीज हमारे प्रोफेशन में एंड हमारे को ये चीज we are supposed to incorporate nowadays, because nowadays with this corona era, people have understood that what is the importance of evidence, what is the importance of research. अगर कुछ रिसर्च या एविडेंस नहीं होता तो we would have found out vaccines, and probably we would have treated corona cases. Yes, but ये नहीं है. Okay, even though a country, Russia country, which is one of the biggest country in the world, which promotes that, or which has told that we have a vaccine now with us, people are not believing it. Why people are not believing it? Because there is no proof of research in it, there is no proof of evidence in it. I don't say that there won't be any research or evidence it, wo abhi tak publicly nahi hai, and even World Health Organization is not having that data. So for that purpose, research is important. Okay, so I always tell my students that whenever we talk about research, whenever we think about research, or probably whenever you are giving a treatment to a patient, you always ask yourself a question: why I am administering an ultrasound, why I am administering IFT, why I am not administering something else, for what reasons, and for on what basis these things are happening. Okay, so even an expert can be wrong at a point of time. Okay, so without wasting much of time, I would like to have a video over this. Yes, please see this video and then we'll discuss. Yes. So this 2.5 minute of video, I got this video from YouTube itself. Yes. So this 2.5 minutes of video, what does it video says? Yes. Because of a failure or because of not knowing things, we have never tried of doing something else. So while seeing this video, हम सबको एक ऐसा था कि यार ये why they are shouting for a help? Why cannot they just climb up a stair, or they cannot climb down the stairs and come out of the escalator, and things would have been solved? Yes, but this is what it is. Okay, so it was just a fun video to have an explanation that what does a role of research says. Research is nothing but a day-to-day activity which incorporates into analytical thinking. Okay, whenever you think that something is needed or some improvement is needed in a patient or something important is needed, we have to and have to think why and how this will be possible, and then we are supposed to have a problem which we are supposed to find a solution. अगर problem नहीं है तो हमारे पास solution नहीं है. So we had no issue. We had before this corona era, हमारे पास there was no problems. Okay, we were into offline modes of teaching. We have taken offline modes of examinations. Yes, and suddenly we had this corona era, and we had swiftly, probably in 15 days to 1 month period of a time, almost every Indian has learned Zoom application. Yes, and they have overcome the issues. Okay, just some couple of minutes back, or probably 10-15 minutes back, I was not able to access through my laptop. Immediately I had to switch it over to my tablet, just because I had to deliver you a webinar. So if before that, if I was not having any other issue, since like this escalator issue, what would I have done? I would have told Dr. Himanshu, please, can we postpone it? I'll try to fix it up next day or probably next week. And then the matter ends there. So that is not the solution. The solution is to move ahead in whatsoever circumstances is. So this is what research is. So moving on, what is research? So first, research is an investigation or an experiment that is aimed at discovery. You're finding out new things. Okay, or interpretation of facts, revision of theories or laws, practical applications of the new or revised theories or laws. So this means either you are discovering new things, you have come up with something new. Yes, for example, you have come up with hamstring stretches and ultrasound gives you a better hamstring flexibility compared to just a hamstring stretch alone. Okay, or you already know that ultrasound and hamstring stretching improves the hamstring flexibility. Then you think analytically, why just only ultrasound? Why not IFT? Why not Russian currents? Or why not my myofascial theories, those revisions, and come out with that and try to solve it. So basically, when we talk about research, yes, the first thing हम क्या करते हैं, what majority of people of us we do is we generally have a mother article. एक mother article हम ले लेते हैं और वही mother article का जैसे हमारे में एक mother article ले लिया हमने कि भाई MFR versus celiac mobilization in computer workers concerned with tennis elbow in US population. तो हम क्या करेंगे, MFR ले लेंगे, celiac mobilization की जगह हम Maitland का mobilization डाल देंगे, computer worker की जगह we will have housewives, and US population की जगह we will have an Indian population, and we will term it out a new research. Is that a new research? For some, yes, and for some, it won't be a new thing. Yes, because it has already been said that MFR is more important. I mean, MFR has proved effective Okay, now somebody will say, see, it was like with MFR was compared with in the previous literature, or probably in my mother literature, MFR was compared with CREX mobilization, but MFR was not compared with Maitland mobilization. So we are thinking that ki Maitland mobilization शायद से अच्छा काम कर देगा, and उसमें in that population it was US population, we have Indian population. In US they had done on computer workers, and in India we are doing on housewives. So try to justify it why you are doing this. First thing is, both of them, both the techniques are mobilization techniques. One is soft tissue technique and one is bone related techniques. So what is their mechanism? कौन सी mechanism पे दोनों काम करते हैं? Second thing is the population, epidemiology, and the target population which you have selected, housewife versus computer workers. So housewife and computer workers mein, what is the difference? Okay, so what is the number of hours they are working, what is the positioning which is happening? So ye sab cheeze kaam kariye. And is there any ethnicity variations? Is there any ethnicity variations in US and Indian population? In these three parameters, if two parameters are equal, I don't think so we need a new research in that terms. If not, then yes, we need a research in that terms. So this is why you need to frame your research problem in an appropriate way, which can either lead to a discovery, या किसी को पता ही नहीं था, और जो है उसके बारे में continuously कुछ ना कुछ upgradation आया. Yes, so this is what research is. So now the question comes, whether it is a research question or a research problem. मेरे पास एक खाली एक research question रहता है या मेरा research problem आता है. Yes. Now what is the difference between research question and problem? Research question is just a one question, okay, which comes into your mind. But a problem is a cluster of all those questions. Okay, so sometimes what happens is that I am doing a study, or I have a question that I have a prolapsed intervertebral disc patient who is complaining of pain since last 1 year, and he has failure, right? Repeated failures of all the treatments, and he has not improved. So what might be the cause? Either it is the disc which is causing the problem, or postural. डिस्क प्रॉब्लम क्रिएट कर रही है या पोस्चर उसका प्रॉब्लम क्रिएट कर रहा है? क्या चीज हो सकती है जो उसके ऊपर इतना प्रॉब्लम कर रही है? Whether it is a question, whether it is a disc or it is a posture. So this might be my question. Okay. Second question. Now, if it is a disc, why my treatment is not working? Either my IFT, which I am giving, it is working on pain gate theory. Yes, it is working on pain gate theory. Then which level it is working? Am I not focusing on core? Yes. If you're not focusing on core, why I am not focusing, or why the core is not strength? So these are clusters of questions which results into a problem. Yes. So research question is a primary question. Okay. So research is the first question. Research question is a primary question, whereas research problem are clusters of research problems. So that is why we have hypothesis coming into picture. So you may have only one hypothesis, or you may have series of hypotheses when you form a research problem. Yes. So so this is the major thing which we always forget. हम क्या कर लेते हैं, हम एक mother article ले लेते हैं. We always take a mother article as a reference, and then immediately we form it accordingly. हमारे में we have already preset mind कि हमको MFR को अच्छा दिखाना है या हमको mobilization को अच्छा दिखाना है, and then we preset के mind के हिसाब से ही we move on with our research, and ultimately we conclude our research. So what are we doing? We are just giving clothes to the problem. We are not solving the problem. So this is not the way actual research is done. Actual research is done through through and through forming a primary questions and set of hypotheses. Okay. So what are the important points which we need to think about? It is definitely challenging. Why challenging? Some odd day, probably in all this webinar era, I had seen somebody's profile. Yes, that person was claiming. I am not saying that that person might be wrong, but I was just thinking in a sarcastic manner. That person was claiming that he has somewhere around 150 research articles. Okay, so 150 research articles in a duration, and that person's age would be somewhere around 50 to 55 years of age. So, agar if we think about 25 to 30 years of experience in the relevant field and 150 research publications, he or she has to publish somewhere around 4 to 5 research papers per year. And if you are publishing 4 to 5 research paper per year, this means you are having somewhere around 2 to 3 months to complete a research. So is it technically accepted? Only 2 or 3 months of research and publishing a paper? Or it is just for a namesake? You're getting publications and you're publishing it. So basically, finding a problem is so challenging and so difficult to accept the scientific world. Yes, we have India is leading into predatory journals. India इतना आगे है predatory journals में publications में that is the reason Indian researchers are not considered now, right? So but uh, I don't deny that fact also, that the younger generations and people have started accepting the research environment also. So this would gradually change day to day, and continuous efforts from UGC and higher authorities. We are now focusing. So for example, uh, people have started learning now in our the place from where I come, like from in our college, we compulsory give research projects to all internship students. Yes, so they are now the students of physiotherapy. They think about research from their bachelor days. Okay, so initially it was from masters. Now we have started thinking, incorporating all those things from bachelors itself. So now things are gradually changing. Yes, it is time consuming. I don't say that I totally deny. I'm not in a fact position that research can be completed in just 1 month or 2 months duration. You would have seen that now it would be almost a year with Corona, and people have not come up with any medications, and people have not come up with any vaccinations. Yes, if it was so, and if it was just for publications, yes, uh, people would have started consuming medications. Yes, or publications आना शुरू हो चुके होते, but till now we are not finding out any solution. So this is what it is time consuming if you are moving on towards reliable and authenticated research. Third thing is lack of awareness. We as a practitioners and lay people, they are also not aware about what is evidence-based practice. How are we supposed to practice, and how the treatment modality is in the country where we stay. Whosoever is administering the treatment is considered God, and there are very few numbers of people, they question that why I'm administered this treatment, why I'm not administered this. Okay, so this is why lack of awareness plays a biggest role into research. Different viewpoints, as I said. For me, if you say that you have a mother article which compares MFR versus MET in computer workers in lateral epicondylgia, and you are doing a research on MFR versus mobilization in housewives of considering lateral epicondylgia, for me I don't think it would be a new research, but for somebody else, it would be a new research. So for the person who is trying to do that research has to definitely convince the scientific world why that population has been selected. Yes. uh, Acceptance. So once you have accepted that yes, it is a problem, you need to find out your solution, and that acceptance needs to be at scientific level. So moving on, the second question which comes, that whether it is a research problem or it is a social problem, या ये research का problem है या ये social issue हो चुका है. We have different issues. Yes, we have from probably uh, uh, even in a state. Yes, even like from Gujarat, and if you go to Rajasthan, state to state, there will be different societies and different society cultures. So रिसर्च करना है या सोशल प्रॉब्लम को इश्यू रेस करके उसके ऊपर से रिसर्च का प्रॉब्लम ढूंढ के निकालना है. सो दीज टू आर कोरिलेटेड, बट डेफिनेटली all the social problems are not your research problems. So basically, research problem is your intellectual curiosity. Intellectual curiosity, yes. So you may think that, why females in Gujarat population or Gujarati females are prone for osteoporosis compared to Rajasthan or probably compared to Maharashtra. So this might be an intellectual curiosity to find out whether the water is the culprit or whether the work pattern is the culprit. What is the culprit? And that can lead to a social research problem. Okay. Whereas social problems is values of group. Okay. So I'm just giving you an example in the next this slide. See, for committing a crime for criminals, किसी जो चोर है उसको चोरी करना है, yes, तो उसके लिए एक नॉर्मल सी चीज है. यस, वो हर रोज करता होगा या उसके लिए एक रूटीन हो चुका होगा. ओके, बट फॉर सोसाइटी और सोशल पीपल इट इज अ प्रॉब्लमैटिक. यस, सो एंड फॉर अ रिसर्चर, यस, क्या है, वी आर सपोज टू थिंक that why this person is doing crime or why this person or people are into this work. Whether it is unemployment, whether it is the upbringing of the child which has led to this criminals, or whether it has the child has underwent any social problems. So this is what researcher needs. Why the criminals have the mindset of committing a crime, and what about law? या किसी को law की पढ़ी नहीं है. Yes, so these are the things which researcher differs. I hope I am able to clear the different mindset of what a researcher, as a researcher, you need to cultivate in your mind. You just cannot have a copy paste attitude. Control C or Control V wala attitude cannot have. Okay, even no softwares can, we have softwares for plagiarisms. Nowadays we have such a good softwares, and plagiarism is at most important thing what we have nowadays, because it is important as far as the what we say uniqueness is considered in research. But what about idea? It is a researcher which has to cultivate. Okay. So research problem is basically a cognitive problem, and social problem is basically an evaluative problem. So अगर कुछ social problem होता है तो we try to find out a solution and sort out that social problem. Okay, we don't have that curiosity to go to the root and think about that. So nowadays I would just say that, to all people who have either started with their research and probably who are thinking to start with their research, please try to think analytically, that in every question try to raise, even when you are studying, try to raise why triode valve is used in SWD, why diode is not used. And please ask that question to your teacher or probably to yourself. And to nowadays if nobody is knowing that answer, Google will be knowing that answer. So we have such a good information available with us. If we say that what is the role of triode का role बता देंगे, but why diode cannot be used in SWD circuit, only triode is used. This is what we need to think about. Thus, research is basically indicating a gap in our knowledge. Acceptance, अगर हमने accept कर लिया, it's okay, yes, but if we have not accepted it, we need to move ahead with that. So what are the basic sources which we have in research? कहाँ से हमको ये सब ideas मिलने चाहिए? Research supervisors, guide, expert. Yes, it is very much important. Research supervisors or guide generally आपके masters से शुरू हो जाते हैं. So in masters you have one guide, research supervisor is necessary in PhD, so that expert guides you. Okay, so if you are into a clinical practice, you have that expert, or probably anything, even your YouTube can be your expert. Okay, second thing is research literatures. At the end of this webinar, I would show you how we can have PubMed, Mesh, and Cochrane literatures. We can search it out on net. Research funding agencies. Now, what is the role of research funding agency? These research funding agencies, they have preset of their problems, and sometimes they give funds to your problem also. You just need to write your research problem. You just need to write your research proposal. अगर उनको अच्छा लगा तो वो आपको फंड करेंगे उस चीज के लिए. So in Gujarat we have Guj Cost. Okay, so this Guj Cost agency, and there are various agencies across pan India जो रिसर्च के लिए फंडिंग्स करती है. So ये रिसर्च के लिए फंडिंग्स एजेंसी आपको कल्टीवेट करवाती है वो रिसर्च थॉट्स के बारे में. Classrooms, you need to have an open mind in classroom. Just come out of those textbook oriented approaches. And I'm very glad that we are into this COVID era and everybody has faced this COVID era, because with this before March 2020, nobody had thought that we would be teaching on online, and nobody had thought that we would be using Zoom, Google Meet, Cisco, etc., etc. And everybody has come out with one or other solutions, and things have come up with majority of positive outcomes. Everything has their negative outcomes also, but onto one side we have positive outcomes also. Community. So what is the role of community? As I said, that why females in Gujarat have more osteoporosis, or probably why they are suffering with more knee pain compared to females across India. So you may need to think about that, and then the research problem will come out. So basically, formulating a research problem is broadly divided into two: internal and external factors. Okay, internal factors जो एक researcher के अंदर से आने चाहिए, और external factors जो एक researcher के बाहर के ऊपर है. Yes, external factors. So for example, I am doing research in my institute. Okay, so I am doing a research on cervical spondylitis. तो मुझे एक question आया कि why isometric neck exercises are helpful in cervical pain. Why not simple traction? Okay, so ये मेरे अंदर एक क्वेश्चन आ चुका है. एक्सटर्नल फैक्टर, मेरे वहां पे उतने पेशेंट्स आते नहीं है तो कहां से आएंगे, एंड हाउ कैन आई हैव, एम आई सपोज टू पे दी पेशेंट्स? अगर मैं पे करूंगा तो मुझे कौन पे करेगा? So these are your external factors. Okay, so we'll discuss all the internal criteria one by one. Researchers' interest. This is the foremost area and which needs to be focused. So that is why we have specializations and super specializations. I cannot ask a pediatric physical therapist to go and have interest in cardiopulmonary, or I cannot ask a cardiopulmonary physiotherapist to have interest in sports. ये एक रिसर्चर का इंटरेस्ट, एरिया ऑफ इंटरेस्ट है. तो एक रिसर्चर को इधर उसको ऑब्जर्वेशनल स्टडीज के बारे में इंटरेस्ट करना है या एक्सपेरिमेंटल स्टडीज पे इंटरेस्ट करना है. ये एक रिसर्चर्स को इनबिल्ट आना चाहिए उसके अंदर से. दूसरा, own resources. If sorry, if I am doing a research, am I having proper resources? Am I having OPD? Am I having my equipments? Am I supposed to give time? मेरे पास उतना टाइम है कि मैं उतना सोच सकूं उस चीज के लिए, या फिर सीधा मैंने एक मदर आर्टिकल से उठा लिया और उसमें आउटकम मेजर था आइसोकाइनेटिक डिवाइस, और मेरे पास आइसोकाइनेटिक डिवाइस नहीं है, so I have just used manual muscle testing. This cannot be the way actual research is done. Competence. Are you really competent enough? Are you really competent enough and inclined towards that research? If not, please don't feel ashamed to just learn it from others. Learn and that incorporate. Even many people, I still learn from my seniors and my batchmates, and even I learn from my juniors. Okay, the first thing which I will tell you on this open forum is, before this COVID era, yes, before this COVID era, I was not aware about Zoom. Okay, when I was supposed to take my first lecture on Zoom, one of my student only told, sir, that I was supposed to take my first lecture on what we say online. So I was not aware that on which platform I'm supposed to take. I was accustomed to Google Classroom, but I have not seen any face-to-face or virtual attractions like Zoom. So one of my student only taught me Zoom. So this is what I have learned. Okay, so you need to learn from any sources. What are your external criteria? Research ability of the problem. This is what I'm saying. Either it is only research, are you just considering it as a research and a part of your study? It's all okay. You do whatever you want. But are you really interested and inclined in solving that problem? This is what makes thing. Novelty of the problem, as I said, is that the outcome of that problem, is that novelty वो कुछ ना कुछ नया लाने वाला है, या फिर वो सिंपल एक्साइटेशंस के हिसाब से यूज किया जाएगा. Importance and urgency. Yeah, similarly, yes, we have importance and urgencies. Yes, तो ये importance अभी कौन सी चीज के बारे में है? COVID-19. So you would have seen there are clinical phases upfront कर दिए गए हैं, speed up कर दिया गया है, populations को immediately vaccine dosages दिया जा रहा है. Okay, so this is what importance and urgency says. Okay, clear? And facilities. So are you definitely having those facilities? Yeah, simple. You are just going to have it in a simple environment and just frame it out as per the outcomes in your mother articles. Okay, so we would be seeing one more interesting videos after this. And feasibility. Yes, are you going to have a practical outcome out of it, and you are not spoiling the patient, you are not harming the patient, and you are not spoiling your own practice also. So these are your external criteria. And social relevance. Okay, so definitely society, we live in a country where society restrictions are much, so we need to think about research in that way also. So we'll see one more video which is very interesting, cute animation, which was again found out on YouTube. So what we have learned from this video is that, you know, if those two bears would have find out a solution, they would have ended up reaching their destinations. But because of their professional incompetence and because of their not the attitude of not finding out a solution, they have landed up somewhere else. Whereas those two bunnies played very smart, and because of their analytical thinkings, they have avoided and they have given what we say an answer to those two bears. Okay, and secondary, they have reached their destinations also. So you would have seen in the second part, those two bunnies have never thought that they would be at the same position again where those two bears were. But when they when they were at that same position, they had that analytical thinking of finding a solution, and that solution resulted them reaching some their destinations and achieving their goals. So please try to incorporate that this kinds of bunny attitude rather than being a stubborn or fixed individual. So basically, problem formulations are of two types. One is deductive approaches and another is inductive approaches. So when I say deductive approach, okay, deductive means a set norms. Set norms are there, and then we are supposed to find out the solutions. And inductive approach is a flexible approach. So we'll discuss what are deductive and inductive. Deductive approach. This deductive approach believes on truth, belief, and justification. Okay, so simple thing is we have Pythagoras theorem. Whether it is true or not, we believe it, and then we justify it to prove it. Okay, so similarly, problem formulations are in terms of developing set of hypotheses. We set of hypothesis, null hypothesis, and experimental hypothesis. The null hypothesis says that whatever the problem which you are setting up, what you are setting up will not be true, or experimental hypothesis says will be true. So this is you are setting up the hypothesis. You need a research design. So whether you are going for an observational studies, cohort studies, case studies, experimental studies, randomized control studies, you need a set of research designs into it. Then sample formulation. So whether you are going with a single sample, you are going with a cluster sample, you are going with sample random sampling. So you need a samples and site samples calculation in this. Dependent and independent variables. So when you are giving a treatment, so the outcome measures. So for example, range of motion. Okay, so if you are giving that my bicep stretchings would improve my elbow extension, so that is direct independent variable. An independent variable will be your pain, whether the pain has reduced or has increased. So this kinds of variables and standard instruments. So how are you going to measure your range of motion? You are going to measure range of motion through your goniometers, okay, or what are other equipments you are using it. Okay, so this is your deductive approach, which is basically based on epistemology. So basically in social sciences we have two things, epistemology and etymology. So जो epistemology पे believe based है, that is known as deductive approach. Deductive approach means you have a theory, and you are trying to find out a solution of that theory. Okay, into incorporating that theory into different places. Whereas inductive approach is like getting familiar to that situation. So example, is online teaching affordable and accepted throughout India? So I cannot go to a theory currently into a Western world, or probably I cannot find out research literatures because ये नई चीज है अभी के लिए. तो ये जब तक theory establish नहीं होती है, और I don't want to believe that theory which has been already proved, I need to go and think about inductive approach. This is to go into the field and open minded. फिर मैं अगर ये चीज पे चला जाऊं कि I am just having a mindset that yes, I'm supposed to prove online teaching is good compared to offline teaching, that is not going to happen with this inductive. फ्लेक्सिबल प्रोसीजर. शायद एक टाइम पे आपको ऐसा लगे कि ऑनलाइन टीचिंग वाज not good, but as you started collecting data, you came to know that online teaching is good. So you need to have and flexible procedures, and people may not be able to accept or may not be able to revert the way. So for example, sorry, the students were not aware about online examinations before this COVID era. Now they have been giving online examinations, they are learning about this. So this is what your inductive approach is. Adopts new points of observation. Yes, you are observing each and everything as the days pass, and this is on ethno methodology, procedures of social sciences. So you are trying to find out new things. So there are two things finding when you are framing a problem, whether you want a deductive approach or whether you want an inductive approach. If you want a deductive approach, you consider it as a part of a stimology procedure where you need specific sets, and inductive approach you need to go into the field and find out the solutions. So these are the basic guidelines. एरिया ऑफ इंटरेस्ट होना चाहिए. रिसर्चर का एरिया ऑफ इंटरेस्ट इज वेरी मच एसेंशियल इनटू इट. Chain of thinking rather than stray problem. Yes, so at a point of time you would feel that you are not coming out with the outcome, you are not thinking, you are stuck up at a place and there is no solution. So continuously think and don't stop at that problem. Just think why this problem has led. Not necessary it should be a new one. हमने ऐसा ढूंढ लिया है कि भाई हर बार हमको कुछ ना कुछ नया लेकर आना है मार्केट में. It is not necessary. You can criticize the very own research which has been done and criticize in a healthier manner. Should not be a true broad. I have seen articles in a way that you know, people have a huge population, okay, or probably they are taking too many outcomes, okay, just to say that, you know, we are doing a big research. No, you cannot have too broad areas. You need to narrow and justify what is your research problems and what need to consider. Magnitude. कितने स्केल पे आप करना चाहते हो, 50 सैंपल पे, 100 सैंपल पे, 1000 सैंपल पे, उसके हिसाब से आपका टाइम फ्रेम आएगा. आपकी लेवल ऑफ एक्सपर्टाइज है उस चीज में. आई कैन नॉट गो एंड डू अ रिसर्च ऑन pain management through any surgical procedures or pain management through any anesthetic procedures. This is not my expertise and I'm not interested in doing that. Okay, or I should not do in combination with any other non-intervention also until and unless I have expertise in it or an expertise member is in my group. Is it relevant? Is it necessary to do this research या फिर करने के लिए ही कर रहे हो आप? What about data? Are you going to have that data? आपको उतना data मिल जाएगा, whether it will be what we say quantitative data या qualitative data. अगर quantitative data है तो what kind of my statistical analysis will be there. अगर qualitative data है तो कौन सा statistical analysis के हिसाब से मैं आगे बढ़ूंगा. Ethical clearance is very, very, very important. Okay, you as far as human studies are considered, you cannot have any odd individual into your studies without ethical clearance. वो लेना बहुत जरूरी है. Ethical clearance is a very huge and broad topic. I can talk on that topics for somewhere around 1.5 to 2 hours at a stretch. But what is ethical clearance? Ethics means usual norms with that which you are not doing wrong thing to any other else. Okay, and principal components, what one wants to know, why you have that questions, originating questions, कहाँ से आए, क्लासरूम से आया, मेरे रिसर्च बैकग्राउंड से आया, रिसर्च लिटरेचर से आया, my research supervisor has given that problem. So these are the things which you need to do. What are the necessary conditions? You need to have an observation. You need to have a relevant literature. After this, I will give you a brief idea about how to have a PubMed and Pedro literature research reviews. Discussion, continuous discussions among your team and professionals to continuously upgrade your research issues. And I want to tell you this thing basically. P means population, I means intervention, C means comparison, and O means outcome. PICO. PICO is the research problem solution. If you think that you want to do a research on Gujarat female population, this becomes your population. Intervention, आप क्या देना चाहते हो? Okay. पॉपुलेशन पे क्या करना चाहते हो? ONE का रिसर्च करना चाहते हो. क्या देना चाहते हो? You want to see whether your IFT is working good or your TENS is working good. Okay, that is your intervention. Then you are seeing comparison. So whether your IFT will work good or whether your TENS will work good. And how will you judge? You will judge through pain outcomes or you will judge it through your range of motion outcomes. If you are judging with your pain outcome, आप सिर्फ numerical pain rating scales रह रहे हो या you are taking subset of questions. If they are set of questions, whether it is reliable or whether it is valid. And if you are taking range of motion, so you are taking only the range of motions of knee joint or the proximal and distal joints. So this is what basic problem finding is. PICO, आपका रिसर्च प्रॉब्लम इसके ऊपर से ही फाइंड आउट होता है, ना कि आपकी एक मदर स्टडी को मॉडिफाई करके. So basically your research problem is into three parts: formulating research issues, framing title, and operationalizing concepts. Formulating research, PICO. PICO. Okay, I have selected a population group or concerned group. So I have selected female patients. कौन से गुजरात के, कौन सी एज ग्रुप, 40 से लेकर 60 एज ग्रुप के, क्या कंप्लेन, knee pain. So this is my P. I stands for intervention. What intervention I am supposed to give? I'm going to give conventional and I'm going to give experimental. Comparison. Conventional में क्या? ONE exercises. Yes. Experimental में क्या? एक side TENS, एक side IFT. Outcome. My outcome is pain and my outcome is range of motion and functional abilities. So this becomes my research formulating issues. So this is way my hypothesis होगा. तो मेरा hypothesis इसके लिए कैसा जाएगा? My null hypothesis is the conventional group will not be effective. The experimental group 1 will not be effective. The experimental group 2 will not be effective. Okay. Your experimental hypothesis, your conventional group will be effective. Your experimental group 1 will be effective and experimental group 2 will be effective. ऐसे मेरे 3 hypotheses हुए एक study में. Framing title. तो title कैसा होगा? The title should be very brief and should give a total idea about the research problem. तो मेरा title होगा a comparative study to find out relevance of pain and functional capacities in females aged 40 to 50 or 60 of Gujarat with ONE. I'm selecting a randomized control trial. I'm supposed to say randomized control trial. I'm selecting an observational study. I'm saying it observational study, whatsoever it is. टाइटल के अंदर आपका रिसर्च प्रॉब्लम और आपकी मेथोडोलॉजी. ओके, टाइटल के अंदर ये दो चीज क्लियरली रिफ्लेक्ट होनी चाहिए. एंड ऑपरेशनलाइजिंग कांसेप्ट्स, हाउ आर यू गोइंग टू स्टार्ट? सो व्हाट आर द ट्रीटमेंट मेथोडोलॉजीज, हाउ वी आर गोइंग टू कंसर्न विद दोस. So these things you are supposed to have into picture. So this is what I will discuss. The databases, Pedro, Cochrane, PubMed, and Google Scholar. तो आप सबको आता ही होगा. Okay, so it's just simple that if you paste anything in Google, they will show you the Google Scholar. So at the end of the slide, I will give you a brief idea about Pedro and PubMed. Even I can say it about Cochrane also, not a big issue. And thank you to the Physio Inculcators group and Dr. Himanshu for again inviting me as a resource person in this webinar. Uh, Again, I'm sorry that I couldn't start the webinar on time because of technical issues. We would have a brief discussion of question and answers. Okay. Just
Thank you, sir. Thanks a lot for a great session, a great learning ahead in this session. And it was a real problem we as a student usually feel when we are in the UG or PG or the research scholar, that how to select the research topic and how to move ahead to perform the research.
yes.
Yes, sir.
Just wait.
Okay, okay.
I'll switch it on with this Pedro. I think everybody is can see my screen.
Pedro,
Yes.
yeah, it is visible.
Yes. Okay. So see, Pedro is basically a physiotherapy evidence-based, and it is based on by universities of Australia. So you can see here it is, they have mentioned 47,000 randomized trials are there. So how are you going to search in this Pedro database? You have two options in this Pedro database. One is simple search and another is begin and advanced search. So simple search पहले दिखा देते हैं आपको कैसे करना चाहिए. See, here simple is, if I term it out, ultrasound therapy. Yes. तो मुझे दिखा दिया जाएगा कि अल्ट्रासाउंड थेरेपी कितने कितने पार्ट्स में है और इसका स्कोर है कि 10 उसका मैक्सिमम स्कोर है, तो कितना परसेंटेज उसके गाइडलाइंस के हिसाब से कितनी कौन से स्कोर्स के हिसाब से जा रहा है. एंड यू हैव अ न्यू एडवांस सर्च, सॉरी, इन दिस. सो एडवांस सर्च में आपको एब्स्ट्रैक्ट में क्या चाहिए? आपको एब्स्ट्रैक्ट में चाहिए ओए नी, टाइटल में थेरेपी कौन सा चाहिए? See, you have acupuncture, behavioral education, electrotherapies, etc., etc., etc. So for example, I am selecting electrotherapies. Yes. Problem कौन सा है? See, here they have asked. This is what I'm telling कि आपका problem भी ऐसा होना चाहिए जो list out हो सके. Okay. So problem is muscle weakness. Body part कौन सा है? Yes, lower leg और knee. सब डिसिप्लिन कौन सा होगा? ऑर्थोपेडिक्स. टॉपिक कौन सा होना चाहिए? यस, क्रॉनिक पेन. यस, मेथड कौन सी होनी चाहिए? प्रैक्टिस गाइडलाइन होना चाहिए, सिस्टमैटिक रिव्यू होना चाहिए. आई एम सेइंग क्लिनिकल ट्रायल. ऑथर हो तो पता है, टाइटल हो तो ये सब उसका क्या है, एंड यू स्टार्ट सर्च. So once you start searching, you will have no records found. So we have not got any, unfortunately we don't have any records based on my search. So आप उसके हिसाब से search कर सकते हो in this database. Then we'll have a brief outline about PubMed Mesh. This is very good. PubMed Mesh is medical headings. Okay, तो PubMed Mesh आप Google करते हो. Okay. तो एक सीधा मैश टर्मिनोलॉजी जाता है मेडिकल सब्जेक्ट्स हेडलाइंस पे. Yes. So here you have an option of selecting. So again, I'm saying ultrasound, or let us say deep friction massage. Yes. So am I having any deep friction massage के ऊपर मेरे पास articles है? नहीं है. तो this means there are no articles based on deep friction massage in PubMed database. तो आप समझ सकते हो कि deep friction massage का कितना validity होगा और कितना reliability होगा. Yes. So again if we'll think about ultrasound करके देख लेते हैं. Ultrasound therapy. interventional ultrasound. Yes. So you go and search. तो इसमें आपको इफेक्टिव क्या आ रहा है कि कौन सी एडवर्स इफेक्ट्स है, कौन सा क्लासिफिकेशन है, एपिडेमियोलॉजी क्या है, मेथड्स क्या है, थेरेपी के यूज के लिए यूज किया गया है उसको, उसका सब क्लासिफिकेशन आप सिलेक्ट कर सकते हो एंड देन यू हैव these results coming into it. So you have indexing, ultrasonography 1985 से 1993 के articles आएंगे and so on. So this is how you do it in PubMed MASH and brief about Cochrane, because if I talk about this, we may extend up to 1 more hour. So this is again a Cochrane database. See, this is Cochrane database. Okay, तो Cochrane database भी सेम ही है, ऑलमोस्ट सिमिलर लाइक पेड्रो. उसमें आप सर्च कर सकते हो फिजियोथेरेपी, जस्ट ब्रीफ आर्टिकल्स. Yes. So here you have 161 Cochrane reviews matching physiotherapy in the title keyword. Cochrane protocols कितने हैं उसके हिसाब से 5. Trials कितने हैं? Yes, you have 11,523 trials. So see, you can see these databases, और इन सब जो databases में है, तो again you can see by relevancy, you can see by so ये reviews है, protocols है. So see, उसके ऊपर से आप physiotherapy intervention, so you can see these studies and then you can refer. So these are our databases, and these are very simple databases which we can incorporate in our day-to-day research practice. So I hope I had given true weightage to the topic and justified the research.
Thank you, sir. Thanks a lot for such a great deliberation on the topic. And we are receiving a great feedback on the chat box. It was really very, very informative and wonderful session. Yes, there is some queries. If you allow, then can we go ahead for the...
Yes, definitely,
answers?
definitely.
Thank you, sir. Thanks a lot. Let me check once from the top if there is some other... Yes, sir. There is a question from Jitendra, sir, from Delhi. Now, if a physiotherapist wants to carry on a research in his clinic, then who will give the ethical clearance, as he is not affiliated to any university? The very realistic and practical
this is one of this is one of the basic I think nowadays with the research which is going on, and people are inclining towards research. तो ये एक basic question हो चुका है, which I have probably answered in somewhere around 3 to 4 webinars previously also. Ethical clearance, there are 2 types of ethical clearance. One is your institutional ethical clearance, and then second is independent ethical clearance. Institutional ethical clearance, agar for example I am into my institute and I am doing a research in my institute, my institute has an ethical body, और उसके ऊपर मेरे को जाके उसको अप्रोच करना है, और उसके लिए what we say, उसको अप्रोच करके I am supposed to get a clearance from that ethical clearance कि मुझे allow करेंगे कि नहीं. Second, in the same institute, or probably if I am not having my own ethical clearance, what can I do? I can go and approach to the independent ethics committee. Independent ethics committee कैसी होती है कि there are set of peoples. So as far as ICMR guidelines are considered, एथिक्स कमिटी के अंदर एक मेडिकल पर्सन होना चाहिए, एक बेसिक साइंटिस्ट होना चाहिए, एक लॉ पर्सन होना चाहिए, एक लेमैन होना चाहिए, एक क्लिनिकल स्टडी वाला पर्सन होना चाहिए. सो देयर आर समवेयर अराउंड 7 to 12 people who combines and gives us your ethical approach. So जो independent ethics committee होती है, they are giving ethics committee for these kind of people. Okay, so please try and find out independent ethics committee in the surrounding regions and approach to those independent ethics committee so that they can give you a ethical clearance. Or yes, one more thing is you can refer CDESCO and ICMR sites. CDESCO, CDSCO, CDESCO site है, उसके ऊपर registered ethical committees का list है state wise, और ICMR पे भी state wise registered ethical committee का list है. Please refer to those ethical committees.
Thank you, sir. Thanks a lot for the great information. And there is one more. Yeah, there is one more addition from the Kalpana ma'am. In the PICO, she want to suggest that there should be a PICOT. The timeline of the type has to be added. So, and that
type itself comes under population. Yes. So what type of study you are supposed to do? Timeline is part of when you are doing a clinical trials. Definitely the timeline plays a role. तो जब क्लिनिकल ट्रायल रजिस्ट्री ऑफ इंडिया में आपको रजिस्टर करना होता है, कोई भी रजिस्ट्री में, वेदर यू आर रजिस्टरिंग ऑन WHO रजिस्ट्री और वेदर अदर कंट्रीज रजिस्ट्री, उसमें आपके फेज 1, फेज 2, फेज 3 ट्रायल्स के हिसाब से चलते हैं हम, और आपको एक एक्सपेक्टेड डेडलाइन देना पड़ता है कि बाय व्हाट टाइम यू आर गोइंग टू कंप्लीट इज ऑल दिस research. Yes, so madam is saying that timeline is all the studies, but yes, definitely when you talk about academic purview for a master's people or probably for a PhD holder, उसको एक time duration में research complete करना रहता है. But as I said, inductive approach is a flexible approach. Once you are stand into a population, आप अगर उस population के अंदर घुस चुके हो and you are finding different problems, it becomes difficult to justify your timeline. You can add a timeline approach till by what duration you will complete, but this, once you are into an inductive approach, it becomes difficult to justify. Deductive approach, yes, you are supposed to give that timeline.
Thank you, sir. Thanks a lot for answering all the questions. Now, I would again request if anybody has still any query, they can even ask. I think we have cleared all the doubts of the participants, and it was really a very good session, sir. We have initiated with around 10 participants, and right now we are having, I think, almost 20 participants here, and in between we had 30 and more participants. So it was really a great and wonderful session, and due to some, I think, connectivity issue, many of the participants has joined and left, but still, I would like to thank all the very respected senior dignitaries who had joined us for the webinar and for continuously supporting and blessing us for these events. For this, I would like to thank my own teachers, Dr. Charu Sharma ma'am. She's joining us long away from the Washington, USA, Dr. Harsh Rajdip sir, and Dr. Ritu Rajdip ma'am. And Dr. Jeban Daniel sir, Dr. Ankur Agrawal sir, our previous resource person, Dr. Jagdish Jaiswal sir, Dr. Amita Anup Sharma ma'am, she's joining us long away from the Saudi Arabia. Dr. Jiten Munjal sir, he is the senior physical therapist at the North DMC Medical College, Delhi, and Dr. Kalpana Jutsi ma'am. She is associate professor in the Jamia Ahmedabad University, Delhi. And we are also honored to have a very known personality, Professor Anand Mishra sir, with us on the board. They have also joined us to attend this session. We are really thankful to you, sir. And also Dr. Vivek Srivastava, our future resource person, had also joined us. Recently, I think they have just left the session. So we are really thankful to all of the senior faculty members, senior academicians, senior researchers, and senior physical therapists, along with all of the attendees and student participants who have joined us for this great session. Heartfelt thanks to the resource person of the day, Dr. Parth Trivedi sir, for sparing their precious time to share their incredible knowledge, even it is a much needed topic, and sharing the information, sharing the knowledge on the basics of the research. How can a person initiate the research, and definitely practical things, how we can sort out the doubts and we can continue the research in our UG, PG and PhD areas. Really thankful to you, sir, for such a great deliberation and great question answer. And it was really a wonderful and interactive session. Yes, sir, there is lastly there is one question, if you allow. Uh, how the platform helps in the research plagiarism. So can you please share some examples of the plagiarism, any software and anything? Or I think you are muted, sir. I think let me unmute you. Please try unmute yourself, sir. Just a minute, just a minute. Yes, sir, you can unmute yourself.
Okay.
Yes,
So plagiarism, if you're talking about PhD actually UGC has given Urkund software to all the universities, and majority of the universities are following Urkund software for plagiarism. Second is this plagiarism software is a paid version. So I'm talking about the paid versions of softwares which is reliable, Urkund. Second one is Turnitin. These two are good softwares which are widely accepted universally as far as plagiarism is considered. If you are talking about free versions we have small SE tools. Small SE tools करके एक software आता है which gives almost same results like Urkund or Turnitin. And second one is Dupli Checker. So basically, but in free softwares, the only problem is we can search up to 1000 words in one search. So that becomes very difficult when you are searching whole once you are checking your whole thesis as a part of your plagiarism. So वो 1000 words, मतलब for example, one general thesis would be some PhD thesis would be more than 20 to 30,000 words. Yes. So what 20 to 30,000 words, this means you are supposed to search it out 200 times. So I would always recommend that, and Dupli Checker, I generally use Dupli Checker. It is Dupli Checker and Cite This For Me. एक Cite This For Me करके एक वेबसाइट है जो आपको रेफरेंसेस साइट करने में भी हेल्प करती है, और उसका एक पेड वर्जन भी होता है which is very cheap, 600 rupees per month. So 600 या 700 rupees per month में आपको references भी आप cite कर सकते हो without any advertisements, and you can have 3 plagiarism checks of your documents. So once you are done with your research or manuscripts, you can always use Cite This For Me. Yes, and yes, I think Kalpana madam is saying Grammarly, Heliobast, and all these are there. But currently UGC is accepting Urkund software.
Thank you, sir. Thanks a lot for such a great deliberation and a great question answer. We are really honored to have you with us on the board, and we'll hope for such contribution in future too if it is feasible to you. Really thankful to you, sir. Again, thanks to all the participants and senior dignitaries. Thank you, sir.
Yes, I'm very much thankful to all.
Yes, sir. Stay safe, stay healthy, and stay tuned. Take care. Good night.
Yes, yes. Thank you, thank you, thank you.